Hi, my name is Christine Preston and I'm one of the registered nurses at the Halifax Sexual Health Center. And today we're going to review how to give an IM injection. It's an injection teaching session that we would normally do in the clinic, and so we're going to show you how to do that. Focus on IM or intramuscular injection today. There are other injections like subcutaneous, which is in the fat tissue. And sometimes we do have patients giving those injections, and if you do end up doing that kind of injection, then you can give us a call and I will review that with you. The process is the same, it's just a little bit different in how you give it and the needle. So the very first thing that we do is we wash our hands, of course, and clean the surface that you're going to be working with and get out your supplies. So the supplies that you need for an IM injection are the giving needle and the draw-off needle, and we'll review that a little bit closer in a few minutes, and the syringe, and again we'll review what that looks like, 2 alcohol swabs, cotton balls, and a band-aid, and of course your medication. And we're mostly going to talk about testosterone today. There are some other medications that we do give for self-injection, but we're just going to focus on testosterone today. And I always tell people the most important thing to remember out of the injection teaching is to get the right dose and to have the right site that you're giving it. Everything else, you can't really make too many mistakes that will be a problem. So the drop needle is 22, so just to explain how needles work, intramuscular needles range from 21 gauge to 25, and it's kind of counterintuitive, but the bigger the number, the smaller the needle. So a 25 is a pediatric needle and a 21 is the largest. You can give with either of these, but we give obviously with the smaller needle, which makes sense, but if you did make a mistake and use the 22, it would be fine as well. It's also an intramuscular needle. So the intramuscular needle is usually going to be 1 inch long, and if we look at the syringe that we use for testosterone is a 1 ml, because usually when we start testosterone, the dosing is very small. So usually you're going to be giving like 0.2 or 0.3, so that's why this is a good syringe for that. And the way that we put them together is they screw together like this. And you'll see that's pretty easy. And you want to be able to take this one off, so you don't want to put it too tight, but not loose, obviously. And then the first step that we do is we pull some air back. We try to put the same amount that you're going to take out of the vial. So if you're taking out 0.3, you're going to put in 0.3 of air. And it just puts a little pressure behind the testosterone, which is quite thick, to help it come out. And we alcohol swab the top of the vial. We always do that right before we puncture it. And then we put the air in. And then what we do is we turn the entire thing upside down so that gravity can help us, and we pull back. And testosterone kind of drips out, it's quite thick, so don't be surprised if this takes a while. This is just water in here, so it's going to come out a lot faster. So I pull way back and let it fill up past my dose that I'm looking for, because I want all the bubbles to rise to the top so I can get rid of them and put them back in the vial. Little bubbles don't matter, you just don't want any big ones. And if you do see a big bubble, you can actually flick the syringe and it will rise to the top, and then you push it right back into the vial and get to your dose. So now what we have to do is we have to take off the draw-off needle, and we're going to put it in the sharps container. We supply most of the supplies here at the Halifax Sexual Health Center, but we don't supply a sharps container, so that is something you'll need to pick up. And we don't supply the alcohol swabs. The syringes and needles you can get from us. So it's the same thing. You're going to screw on the 25 the same way you did the 22. This one, it doesn't matter how tight you put it, because you're not going to take that needle off. You're going to put this whole thing in the sharps container when you're done. So now what you want to do is you have your dose, but you need to fill the hub, which is this space here, because it's filled with air right now. So you want to fill it with the medication, and you don't want to go too fast or you will squirt it at the top and waste your medication and have to draw more again. You'll notice that the dose now looks like a little less, but you just remembering that it's in the hub now. So you still will get it. It's still the right dose. So the next step that we have to do is, now that we have everything ready, is to locate the muscle where we're going to give the injection. I landmark the vastus lateralis muscle, which is a large muscle that runs from your hip to your knee. And this is your quadricep on top. The vastus lateralis is actually on the side. It gets smaller down where it's connected, but it's quite large here. So it's not a muscle that you will miss. But how you locate it is you put your baby finger against your kneecap and your other hand way up on your hip. And then in between your two hands, you're going to create in your mind an imaginary rectangle. And you're going to want to go mid-rectangle. So like that, imaginary rectangle, mid. Once you have the spot, I kind of keep my hand there, and I'm going to alcohol swab that entire spot that I'm going to be giving the injection. And what I do is I actually lay the alcohol swab on my site so that when I take my hands away, I'm still very clear about where I'm going, and I make sure that it's pointing towards the location. So now what we do is we get the needle ready to give. You want to make sure the bevel is towards the ceiling. So what that means is the opening that you see is up. We call that bevel up. And you hold it like a dart, and you actually go in like a dart as well. Not hard, but swift and firm. If you do go slower, that's fine too. You will build up your speed over time, but the faster, the better. And so I usually just kind of stabilize the muscle with one hand. And I just go in swiftly, quickly, right up to the hub. And once you're in, you can just start injecting your testosterone. And it's quite thick, so it doesn't go quickly. And once you're done injecting it, then you wait for 5 seconds so that the muscle can trap around the fluid and keep it in there. And then when you're ready to pull out after 5 to 10 seconds, you go straight out. So, when you take the needle out, there could be a tiny bit of bleeding. Usually there's none, but if there is a little bit, you can just use a cotton ball to put a little bit of pressure. You may have hit a little capillary going in. And then after that, once there's no bleeding anymore, you can put a Band-Aid on it if you want to, but you also don't have to. That's your choice. So it's not necessary to use a Band-Aid, but some people want to put it on there, especially, if you're wearing lighter clothes or to be safe. Injection teaching for IM injections, and just some important points to remember: that to check the expiry date on your medication, to make sure that it's the right dose that you're drawing up, and obviously the right drug, which shouldn't be an issue since you're usually giving your own drugs, and that you're also finding the proper injection site. And the only other thing is to make sure you rotate every week, or bi-weekly if you give your injections bi-weekly, from one leg to the other, just to give the leg time to rest before it gets another injection. And if any concerns come up or you have any issues, you can always give us a call here at the Halifax Sexual Health Center, and we can answer any questions that you might have. Thank you.